My name is Immaculate Awor. I'm a proud counselor. I work with Malme, Uganda in Mityana Hospital as a counselor under the ELMA project. And ELMA, basically we deal with children. We are here to find the HIV positive children and link them into care and to ensure that they get life, to ensure that we save life. How I go to the conference, first of all, I'm excited and I thank my team for this opportunity. I got to the conference because my boss sent me an email and she told me there's a conference in South Africa. It's about pediatric HIV and adolescent, that is PATA, and so I was excited. I was like, okay, this would really be good because it's lovely to, showcase your work. If you do great work, it is really nice to share with the world so that others can see how you do it, how do you achieve your success, what is that unique thing that you're doing to make sure children out there and adolescents out there stay AIDS free. And for those who are already HIV positive, what can be done? Of course, one thing as a counselor, encourage them that life still has to go on. Whether you're HIV positive or you're not HIV positive, at the end of the day, it is life. Life has to still go on. So that's how I got to know about PATA. And so I filled in some forms, I collected some data. The forms were a bit long, but with my work, I don't see it as long because I feel proud when, yes, it is still my data. I have to collect it and showcase and see how we can put all this together. But I just wanted to share with the world that great work that I'm doing down there to save life. Oh, okay, that is a bit exciting. Okay, I really don't know, but I'm just excited. Number one, why I think each and every one would have got an opportunity, especially the healthcare providers, in order to just share. It's very important to share what you have. We have issues where we are having issues with adolescents, and there are some challenges, and some of these challenges cut across. You may find a health worker in Uganda, in Mityana Hospital, like me, facing a certain challenge, and there's someone maybe in South Africa who is also a counselor, a psychologist, maybe a health worker that has ever faced the same challenge. And maybe you can sit down, talk together, share your experiences, and from there everyone can, you can borrow ideas and practices and see how we can handle this. But above all, we just need a free AIDS Africa. And with adolescents, when I get to talk about them, I'm passionate. I love them so much. We have issues of adolescent girls, and whereby the trend of HIV among adolescent girls and boys, there's really a trend that is so big. The girls are really most affected, but sometimes you really see that these girls, there's a lot. A girl needs maybe to do her hair. She needs to look nice at times, but she doesn't know where to get the money. And sometimes they need the easy way to go. That's why, like today, still to promote and show what we do. In my facility, we have adolescent clubs, whereby in these different clubs, people have different talents. So we encourage. Actually, as I came, I told each person, and we also have mothers who are taking care of these children. Sometimes they say they don't have money or this, but we need to look at something that is also sustainable. As a health worker, you will not every time be pulling out some money and giving, go and buy this for a child, but you need to see how will it be sustainable even tomorrow when you're not there. So we encourage them to do craft work. That's why I brought some work of them, like few stuff, maybe necklaces, handbags, so that you can buy them and support them, because we have issues of markets, and so I also encourage that too. So basically sharing the experiences and showing someone how it is really lovely to see that a child is healthy and they grow up. With that question, for the healthcare providers or the frontline providers, number one, of course, here if we talk about the ministries, it's very important because we have situation whereby, for example, I work in a government facility, but I'm employed by an IP, and you find out cases whereby in my country the job scales of my country the government does not employ a counselor. they don't have that in their work, in their salary scale. So a counselor like me who studied counseling, if an IP like Mildmay doesn't come in and say, oh, the counselor can really do good work, maybe I'm just going to be home, or at the end of the day you do something, some other work that is not your passion, and yet you have left it behind because you can't be employed by your government. But then with this HIV, we need to integrate it in why these are special groups. A child is a special person, an adolescent is a special person. Yeah, maybe sometimes you talk of a child, the caretaker or the mother will decide for them, will say, you know, this child needs ART, and they will carry you to the hospital, because the parent knows why you should be alive. But then for an adolescent, sometimes they need these services to be more friendly to them, because as a 14-year-old, a 10-year-old, some of these children have started being sexually active. So we need this into the government, whereby the nurses or the doctors, the clinicians are being trained in also this field. One thing I love about Mildmay is they do training, you know, at least they try to train pediatric and adolescent HIV to the health workers so that they can integrate. As a counselor being employed in there, I'm tasked to do continuous mentorship to these health workers and also the peer educators, because these peer educators are more close to them also at times, so that tomorrow maybe if the counselor is not there, there's someone, you're very sure that the work you started didn't just go to collapse, but there's someone that took it on. So at the end of the day, there should be a sustainability plan, and that can only be done when the frontline providers come in. Say, okay, it is HIV. Every time we talk about HIV, you talk about counseling. Then a counselor is important. You see that? So if a counselor is important, a nurse is there. There's a work of a nurse, there's also a clinician, there's also a doctor. We know that not every doctor can be a good counselor, so someone else can do that. So all frontline providers, yes, they can all adapt policies. Try. Yes, it may not be easy, but they can try to adapt to that. Thank you.